With breaking news from the Olympic Games in Beijing, John Northcott has latest word that we're just getting from the Canadian Olympic Committee. John?
Yeah, indeed, Heather. This is a situation where, and this is from the statement from the Canadian Olympic Committee, saying that currently 5 of the Canadian contingent there, now that's coaches, that's athletes, that's mission support staff, all of that, currently 5 of the 246 members of the Team Canada delegation in Beijing are in COVID-19 protocols. And they go on to say, we're following the Beijing 2022 playbook rules. Part of our strategy was to arrive early, and those are the shots we showed you immediately after it happened yesterday in Beijing. Part of our strategy was to arrive early to allow time for confirmation testing and, if necessary, the medical expert panel process to unfold. Now, again, those numbers, 5 out of 246 members of Team Canada delegation in Beijing are in COVID-19 protocols. That's the statement. What does that mean? Well, those are protocols, and that doesn't necessarily mean testing positive. And this is makes sense because of the way things are set up. The protocols are isolations and series of testing. Could be you are considered a contact. The rules to get there, as we've been talking about, extremely tight. 2 tests. This is anyone arriving to take part in the Olympics in Beijing. 1 96 hours before departure, 1 72 hours before departure. They are PCR tests. And then on arrival, there is another test. So effectively, those team members arriving were tested on arrival, and then we're isolating in their accommodation, expecting results within a few hours. So this is what we're going to see out of this. In other words, those that arrived yesterday, that test taken on arrival, and then as a result of those tests, they are in this protocol scenario. So as I say, they could be positive cases, but not all. They could be those who were with those who tested positive. So you've got those who tested positive and those then who would be in the protocols where if they didn't test positive but were considered a close contact, they would still be allowed to train. And they would have to, though, quarantine in a single room. They would have to dine alone, and of course, face coverings, all that, and tested every 12 hours. So this is, again, 5 out of the total team sent, 246 members that are there now in some form of COVID protocol. And they're saying they're not releasing any identities at this point without the permission of the individuals involved. If, for example, they were still positive or still symptomatic such that they could not compete out of the chosen sport and sent home, again, they would not release their identities. They'd simply not be on the roster without the permission of that athlete. So this is the situation. Yeah, go ahead.
It's interesting. We've talked about this, John. I interview with the Chief Medical Officer of Health for the COC heading over there, and the concern because the Chinese were going to use an even higher threshold of sensitivity for those PCR tests, and there was quite a bit of concern that it would pick up lingering virus, days, weeks, even after the person was no longer contagious. So they reduced the sensitivity threshold somewhat, but there still is concern. And I think even that statement talks about shedders, people who are not contagious, but still might be picking up with that very sensitive PCR test.
Yeah, and it's funny, they use the word shedders, and they relate that to why they are not revealing the identities of the people, which trying to circle that square in terms of exactly how, but as you say, it is that those PCR tests that are very accurate for a reason, but worried that perhaps it would detect people on that shoulder when they wouldn't be contagious and wouldn't represent a threat. This gives you an idea of how stringent Chinese authorities are being in this.
Yes, if there's a positive on those 2 tests, not allowed to participate. And this is, of course, dreams dashed. So it's a serious story. And thank you, John.